I found the wrap up for a podcast. I couldn't find the other pages. I don't know where they've been put away, but we can, you
In
know,
my,
base.
yeah.
All right. I'm going to let you start it.
Let me, okay. All right. Yeah, actually, I'm there. The- all right. So welcome to Ask the OT with Gina Grothoff, where Gina answers the questions that you might have in regards to caring for your aging loved one, whether they're in a facility or they're in a hospital or they're at home with you. And there are questions and difficulties that are happening that you just don't know where to turn. This is the place that you can go to turn to get some of the questions and also to take advantage of the idea that Gina does consulting. She can come in and talk to you about what's going on for you, to kind of analyze what's happening in your household with your aging loved one, and be able to help you assess the house, help you to find the answers and advocate for your loved one, whether in a facility. All of that can be done with a consult with Gina. And so today we're doing Ask the OT, and we're going to do it live with Gina Grothoff. And here's Gina now.
So I'm Gina Grothoff, and I've been an occupational therapist for 32 years. And most of that time, 30 years really has been in all of it, has been in adult and geriatric rehabilitation. So I've worked in acute rehabilitation hospitals. I've worked in skilled nursing homes with rehab care, people who live long term in the nursing homes, people who come there short term, after the hospital and they need rehab in order to get back home. I've worked in assisted living facilities, independent living, memory care, and I've also worked in home health care. So if your loved one goes home and they have home health therapy services. So I have all this experience working with patients and their families and navigating things as an occupational therapist. I look at how people function in their environment. The goal of occupational therapy is to maximize their independence and safety, to be able to maintain their highest level of independent functioning, um, in the most least restrictive environment, meaning where can they live the most safely to be able to do as much for themselves as they can, to maintain their quality of life. And so I've been doing this for years and a lot with educating with family members because that's a big part of what I do, especially when you're talking short-term rehab. Your loved one's in the hospital, they fell, they had pneumonia, maybe they just had their hip or knee replaced or a shoulder replaced, or they've had a stroke or other medical conditions, COVID, that's put them in the hospital. And the older we get, the slower our recovery can be. And you spend a day in the hospital, it takes a good 3 days to just recover from being in bed for a day. Think about how when you're sick and you stay home and you sleep, and then it takes a while to get your energy level back to be able to, get through the day and do everything you need to do. Well, the older we are, and depending on our activity level, I meet plenty of 90-year-olds who are very active and they bounce back more quickly, yet it still takes time. In the hospital, they are tests that they have to do. They try to get some therapy. Most places are better about knowing people need to get up out of bed. They need to move as long as they're safe to do so, as long as they're medically safe. Um, and so you spend time in the hospital, you're weaker. And if you have other medical complications, that's why you go to rehab to build that strength back up to be able to get home or to be able to say, okay, you can't live alone anymore. We need to look at an independent or assisted living or bringing in caregivers or what are those options? And it looks so different for different people. Obviously, cost is a big factor, and there's great resources and services out there. And yet, unless you have long-term care insurance, um, there's a cost involved. And there are modifications and things that you can do that are low cost options. And so I've had experience in all these areas from, you know, can someone get into their house safely? We did a whole podcast on that, kind of bringing mom home, whether it's for a visit or to move home or her home. Can she live in it and function in it? We did a podcast on that, Don. We can maybe share a link here if you're watching this after the fact.
Yes, yes. And I want to just add in here just to remind people, I didn't say this at the beginning, but if you want to pose a question right now, if you're listening, you can do it in the chat section, or you can email me at don@focusedhealthyfamily.com. You can also text me at 704-562-1630, and I will pose the question to Gina so she can respond. Uh, if you're listening to this after the fact, don't be afraid to email. You can email me, and we will put a response out to you. And then we can also talk to you about consult to help you out even more.
So Don and I are going into speaking at different places, going into facilities, support groups, whether it's a Alzheimer's or dementia support group, Parkinson's support group at a facility where people live. Or if you have a group of friends and you're all dealing with this and you'd love to have someone, talk and share, we can do that virtually or in person. And, we do these live things to be able to help people and get some information. And, in order for me to really help you in your specific situation, I'd love to, you know, consult with you and be able to provide more one-on-one information and support. So that's my kind of consulting business with Ask the OT that I'm up and growing. And so reach out to us for more information on that. We'll continue to do these a couple times a month you can send in a question ahead of time. You can text it while we're here. You can, if you watch this after the fact, submit a question for next time we do this. And we can address, all the different areas that are involved. And again, though, if you have, more specific concerns or you're like, I've tried that, it doesn't work. I'd love to be able to help you out because sometimes it's a matter of understanding the family dynamics, the personality, what that person's like, what they did for a living, because that affects how they function and how they think about things. And, to minimize their fall risk and safety hazards. One thing is we can never guarantee our loved one, our parents are going to be 100% safe. We can't guarantee they're not going to fall. We have to minimize risks and keeping people independent. You have to balance that out with that safety hazard and risk. It's, there's, as a therapist, there's the way you should instruct patients to do things the right and the proper way. And it's got to be this way, or you're not safe to do it by yourself. And yet, the reality of it is sometimes different things work for different people. And the reality is, we can't guarantee nobody's going to fall. And we have to weigh the pros and cons. Is guarantee, making this person sit in their chair and never get up and walk so that they don't fall, is that having a negative impact on their quality of life? Is that really better for them? Or making their environment as safe as possible, giving them the support that they need so that they can move about more freely? And what are their risks of falling? Some people, if they fall, they have greater risks of broken bones if they have osteoporosis or, other things. So there's just a whole lot of factors. It's not as simple as this works for this person. It's going to work for everybody. Um, and so we have any questions coming in, but we're always, looking at questions that people have sent us and from other conversations we've had to provide, some general information and advice.
Well, here's I found in uh, one of the questions poses, how do I know if her issues are cognitive issues or just downright oppositional behavior? Is there a way of telling? Is that a thing? Um, that's kind of an interesting question.
And that's where, therapy services can be so helpful. And as an occupational therapy, I study human anatomy and I understand the body and what people call physical therapy as far as that component of, physical therapists have much more training in balance and what we call gait, like how they're walking and the specifics of walking in the foot and how all that operates. So I don't have as much training in those real specifics, but I have a general understanding. And But also as an occupational therapist, I cognitive our cognitive skills, how we function, how we think, how we make decisions, how we process information. That's all part of how we function. And so I have extensive background in that. And it's often a combination of things. The other factor that goes hand in hand with that is their hearing. Sometimes people think people are confused and they don't understand. They just can't hear. And oftentimes it's a combination. People can have some mild memory impairments, um, but have, an oppositional personality or have hearing issues. And if someone is dealing with early dementia issues, they might become more resistant because they're trying to hang on and hold on. And they want to cope, and their coping strategies might be to cover it up and to they don't want to give up that independence. So they don't want people to think that they need help. And I mean, imagine, you're used to doing things yourself and someone's gonna I'm gonna take your car keys away and you can't drive anymore. And like, well, then I can't go anywhere, then I can't take care of myself, and oh, I'll just do it all for you. And, would you want that? Would you want someone to come along and just step in and take over? And we have to think about our aging loved ones. They're still people, even if they have significant dementia, even if they're Alzheimer's and they're at the end stages, they're still a human being. And they're still people who have feelings and thoughts, and they still have a desire and will to function and live in their world. There's usually better understanding than we think there is. People often can understand more than they can communicate. Kind of like with children, think about little kids. They're paying attention, they're picking up. You say one curse word and they're repeating it, and yet they can't always communicate everything, but they can understand a lot more. And the same is true for a lot of people, dementia and different stages of things. Not that they can, surely they can't process and understand everything. And like with my dad with his Parkinson's, he needs to process one thing at a time. If you say too many things, it's overwhelming. His brain can't compute it. So we have to focus on one thing. We have to repeat it. And then he can understand and he can follow a conversation and he can participate. But as soon as we start talking multiple things in a row, so often a little tangent of cognition, but what I've seen in working with people with dementia is their personality often becomes like exaggerated, because there's some easygoing people who are like, okay, I realize it's not safe to drive. Okay, my daughter's going to help me out now, and this is okay, and I'm okay with this. And then there's those hard-driven type A's, and they're gonna do it themselves because you can't depend on other people. Think about how they were as a parent and how they were as, and maybe even you don't realize how they were in their work environment or, with other people. And sometimes, depending on where things are affected in the brain, if you're talking stroke and some other brain injuries that can happen even from a fall, the area of the brain that's being affected can change personality, can affect their impulse control. It depend, where in the brain these things are happening. It affects different aspects of that person. Um, so dementia, it's a disease of the brain. Our brain controls our body movements. It also helps us make decisions and problem solve, um, and so when those areas are affected, it changes that behavior. I've just said a whole lot there, Don.
You did, you did. I mean, so just as since
To
we're about
recap,
well, since we're in the middle of this, is to remind people you're watching Ask the OT. If you're watching this after the fact, you still can pose questions to you can email me, Don at Focus Healthy Family, and we'll try to give you some type of response and maybe talk to you about whether you need some help in consulting. If you're watching right now and you want to leave a question in the chat, I'm addressing the chat. I'm putting out information, letting people know that Gina's on right now. We do these live. I believe the next one is, let me double check, but I believe it's the 17th.
we tend
We're
to do
doing,
them Wednesdays at noon Eastern
yeah.
or Tuesday evenings at 7 p.m. Eastern. And if you have a group of people and you'd like to do it with the group at a different time, reach out to us and let us know.
No, I believe
So
it's
the
the
next one,
17th.
Don, is,
I'm looking,
oh,
I'm
he's still
double
looking at it.
checking. I didn't get a chance to do this before and write it
That's
down.
okay.
So
While you're doing that, I want to
yeah.
recap that question. How do I tell if my mom or whoever is has cognitive issues or they're just being stubborn and obstinate? So that's where getting assessments from professionals really helps. But it also helps, I have to understand a person and who they are to be able to discern some of these things. And there's often a combination. So, speech language pathologists, neurologists, occupational therapists, people who look at, there are specific assessments that can be done. And someone who's oppositional is probably not going to want those assessments being done. So this is where you have a challenge. If they don't have physical limitations that put them in a position for needing skilled therapy services, whether it's home health, outpatient, the hospital, um, then it can be more tough because this person is physically able to function, and you're seeing issues, you're worried about their memory. Are they taking their medicine? Are they, are they safe at home? You want to give them help and support and they're resisting it. Um, and that's exactly the kind of thing that if I consult with you and I can get talk with you virtually or however, to understand that person as well as you and the dynamics, that's something I can help with. Um, and connecting you with the other resources too to help get the support and help identify those things. Let's get a basic hearing check. Let's make sure their hearing isn't part of it. Have they refused to go to the doctor? Are there other medical things going on that can lead to it? The biggest thing, or one of the most common things with the elderly, is getting a urinary tract infection. And a urinary tract infection and other infections can cause confusion, behaviors, all kinds of cognitive issues. And those of us who work in nursing homes and those like facilities, if someone's all of a sudden is acting more confused or having more issues than they typically do, like you go to the nurse, have they been checked for a UTI? And urinary tract infection. So there can be other underlying things involved. And so there's a lot of different pieces and parts that need to be looked at. So my role is helping to support you, um, helping to find the other resources that you might need to look into. And my expertise is working as an occupational therapist, as a consult, right? I'm not billing this. This is privately paid consults. Not billing this through insurance, but I have, this expertise behind me. And I want to be able to help other people. And, I'm limited in my setting. In the healthcare world, if you've had a loved one who's needed to go to therapy after the hospital, the changes that have happened in Medicare and reimbursement and things affect how much time I get to spend with people. And, every time Medicare makes a cut and we're going to save money, um, we're going to make this better for the patients.
I'm,
Did you see
I'm
that? I
no.
did this and confetti came down. Did you see the confetti?
Well, now I see. I'm looking on
Um,
YouTube and seeing it because
my
it's a little
MacBook
bit.
has these new features. If you do certain hand motion signals, then things show up. Like we did this with the heart before. Um,
I've been putting in some links. I put a link to the assessment, the podcast we did about home assessment.
Home assessments, yeah.
Yeah,
So people, when if you people are getting more and more frustrated with they're not getting the therapy that they need. If you've had the fortune of your person being able to go to a acute rehab hospital, so from the hospital going to a specific rehabilitation hospital, that's different than going to a nursing home for rehab. But there's different requirements to be able to go to it. They do 3 hours of therapy a day. They're a hospital. They have doctors there around the clock. It's different. Um, than a rehab facility. And the restrictions and the expectations and demands that because of the cutbacks and the reimbursement that they're putting on the therapists, it's not that they don't want to spend time with your loved one. It's it's that things have changed. And so that's, part of my frustration is the things that I want to be able to do and help families with, the setting is not set up for me to give that much time or as much time as I'd like to with people. And I know
yeah.
that's the case in many places. And I've talked to many families and, I engage with people and I listen to people and but the constraints of how I'm expected to function and the productivity standards that I'm expected to meet. And, I don't work full time. I work as needed. I work part time. I do that to juggle my family. And I've always worked that way. So I can, my family's always kind of come first. Yet I do need to pay the bills.
Mhm.
So I want to bring that to people. I want to kind of give you that experience of what someone who works in this profession can provide and really do it one on one with you. And so that's what I'd love to do for you with, your particular situation and questions, whether it's a 1 hour consult or whether we work more on a regular basis with us. And as we grow this community, building a community of support as well, because so many of us are in this situation. Um, the baby boomers are kind of the largest population out there, and they're reaching this age where they're kind of doing a little bit of both. Don's kind of at the tail end of baby boomers. I get a lot of people who are in their 60s and 70s, and their parents are still living because people
Yeah.
live longer. And so they've got their own health issues, right? And they're caring for their aging parents. I work with patients who are 90 and like, oh, my son's broke his leg or he's going through back surgery. And so he can't even help me. And
Well,
that's
yeah. I mean, I was talking to somebody at work and just mentioning about us doing this, and she said, and I know her father is going through starting to show some minor signs, and that's why I was saying, well, it'd probably be good to have a conversation with them now. Oh, well, they don't want to talk about it. And I said, well, here's the tough part about that. These situations can change in a blink of an eye to a situation where they may not be able to make the decisions for it. So wouldn't it be great to talk to them now? You
So you're
know,
talking about someone who's showing early signs of dementia and being able to talk to family members about what do you want in the event that you need care and
yeah,
assistance. And a
yeah.
lot of people don't want to talk about that, and understandably so. It's not an easy subject to talk about. And that's where Don and I do communication skills classes and workshops because they are difficult conversations, and how you say it and how you approach it can make a big difference
Mhm.
in their willingness to participate and respond. And, we have to have an acceptance that talking about those things is difficult for them. And, a lot of people of the silent generation and living through the depression, their generations have different, um, not talking about and sharing about personal information and there's people who anything to do with death and
Yeah.
different things that people don't want to talk to, whether it's their generation, whether it's their culture or their own life experience, trauma that they've been through, their personality. And we need to respect where they're at, and we need to understand each other, just like communicating with our children, our spouses, our at work, your coworkers. Communication is such a big part of this, and it's how you communicate it. If you just walk in and say, you're not safe to drive, I'm taking your keys. And there are people who think they're approaching it and they're being patient and they're having conversations and they're still butting up against a brick wall. Um, there are still nuances, and everybody's so different and individual. And like this typically might work better, but it might not work for your situation. And again, that's where, getting that opportunity to consult with me, to work one on one with someone, to have, kind of that more individualized attention, because it can be so very different. There are so many factors that go involved into this. And thinking about someone who's 65 plus, they have that many years of life experience and that they've lived, and it doesn't just go away because now they have dementia.
Yeah.
Um, that's still part of who they are. And so how they process this and how they're going to get through all this, it looks very different for different
Well,
people.
I definitely think I stirred up some thought process for them today by just mentioning, and I did give them a little bit of talk about some of the words they might use and the approach that they might make. So I think it definitely stirred because she was talking about her her father's gait had changed, the way he was
How he
walking.
walking.
And I said, "Oh my gosh, you got to think about all the rugs and the other thing, and assessing that house and so
Well,
that
and
he
taking
doesn't
them
fall."
to a neurologist, if you have seeing changes like that,
Yeah,
understanding the underlying cause as well.
yeah.
Um, yes, the minute you say that, I'm like, have we looked into Parkinson's? I mean, I know nothing about this person you're talking about, and in confidentiality, but yeah, there's a lot of misdiagnoses out there, and Parkinson's is one that it's someone recently told me there is some new test for it, but typically, it's diagnosed by symptomology and by ruling out other things. And yet the medications that they have for it can really help to minimize and slow down the progressive nature of it. And I've seen people who were not diagnosed and just went downhill so quickly because
Yeah.
they weren't treated for the Parkinson's. I've seen people who were diagnosed with Alzheimer's who, I'm not a doctor, but there was one woman, she clearly had Parkinson's, not Alzheimer's. And, if you're not getting the treatment you need, because the doctors are well-meaning, but there's so many different nuances and specialties here that you might need a second opinion. You might need to find a different doctor. Maybe you're in a rural area and, just finding the right qualified person because those things happen. People get misdiagnosed and things get missed. So really kind of tuning in and paying attention to that. So hope you can join us next time, which will be,
Oh yes, it's July 15th, 7 p.m. It's Monday. It's a Monday,
oh, it's a
7 p.m.
Monday.
It's next week actually, next Monday.
Okay. It's a
And
Monday at 7 p.m. Okay. And
and go ahead.
join us on our podcast that we air every Thursday, where we talk all things caring for ourselves, our parents, and our children. And again, lately our focus has been aging loved ones, but if you also raising children, be sure to scan through the categories.
Yeah, and I posted the one about assessing the home. It's up on the chat, the link for that specific one. Also, if you are interested in finding out more about us, you can go to www.focusedhealthyfamily.com. You can contact us there if you'd like to have a consult with Gina talking about what's going on for you, having her help you kind of come up with maybe a plan or some thoughts and direction for you with your aging loved one and what might be the next steps for you. Gina can help you out with that. Take some time to sit down with you and go through your situation.
And, as always, the sandwich generation and juggling these responsibilities. As we're sitting there, all of a sudden, I thought I got cut off, Don, because the screen of the picture of us disappeared because my son's trying to call me and reach me, and he was texting and not getting a response, so he called me. Um, because parenting matters. This is why I work part-time, and so we understand that juggling many different needs and
Well, and then I guess to reiterate that not only professionally that that you're in this, but we're in the midst of it right now with in our own family with these same kind of issues that we're dealing with on a daily basis too. So we bring that and the resources we've learned and the professionalism that both Gina and I have into what we do for people and helping people out. So
join us, focusedhealthyfamily.com. Learn more about us, see our links to our podcasts, reach out to us, see the blogs that we've written regarding these topics as well. Email us, follow us on Instagram. And remember, how you speak to your children and your loved ones today shapes